Hello everyone. So today we'll discuss about endocrine system. So the definition is it is a system of our body that consists of glands and group of capillaries that facilitates diffusion of hormone to bloodstream. Gland secretes hormone and hormone diffuses to bloodstream through capillaries. And so about glands, glands are a group of cells that secretes particular chemical substance, that is hormone. That means gland. Tissue is also a group of cells, but glands tissue does not secrete hormones, but gland secretes hormone. So hormone is a what? Chemical substance. So then glands also secretes hormones as well as enzymes. So on the basis of that, it is divided into three types. So exocrine gland, endocrine gland, and heterocrine gland. We'll discuss it later. So come to endocrine gland. So what is endocrine gland? The name itself says that no duct. Endocrine, that means here it is endo, that means no duct. Here duct is absent, but in exocrine gland here duct is present. So here it is said that it is a ductless gland. Here duct is absent and it directly secretes their substance, that means hormone, into the blood, and this secretion is called hormone. But in exocrine gland secretes only enzyme and it has duct. So along with the duct, the enzymes are passed. So examples of endocrine glands are here discussed. So what is that? Hypothalamus gland, pineal gland, pituitary gland, thyroid gland, parathyroid gland, thymus gland, adrenal gland, pancreatic islets, ovaries, and testes. So we will discuss in this chapter about these glands only. Okay, and now what is exocrine gland? Exocrine gland has duct and it secretes enzyme. So the examples of exocrine glands are sweat gland, salivary gland, mammary gland, stomach, liver. So we'll discuss it later. Okay, so let's come to the pituitary gland and hypothalamus. Before coming to the point pituitary and hypothalamus, we'll discuss about heterocrine gland. So heterocrine glands are those glands that performs about both exocrine and endocrine function. The example is pancreas. So pancreas acts as a heterocrine gland, that means it secretes hormone as well as enzyme. So what is hormone? Hormone is a chemical substance which is secreted or released in one part of the body and regulate the activity of other part of the body. So hormone is produced in one gland or organ. That means suppose it is secreted or formed in pituitary gland and it secretes on the target gland. Then target gland is stimulated, then it will act. Okay. So about pituitary gland and hypothalamus, so both are working as a unit. Okay, without hypothalamus, pituitary gland cannot work or function. So hypothalamus is the boss. So hypothalamus gives the order and according to that order, pituitary gland works. So what is pituitary gland? Pituitary gland's location is, it lies in the hypophyseal fossa of the sphenoid bone below the hypothalamus, to which it is attached by a stalk. You will see the diagram that pituitary gland, where pituitary gland lies, it lies in the hypophyseal fossa of sphenoid bone. There is a sphenoid bone in our skull. Okay, so in this sphenoid bone there is a hypophyseal fossa. There is a cavity. In that cavity, pituitary gland is lie, and pituitary, above this pituitary gland there is hypothalamus, and hypothalamus and pituitary gland is connected via a stalk. Okay, so you will see in the diagram. So let's discuss in the diagram. Okay, so coming to the diagram, in this diagram, okay, in the diagram you can see that hypothalamus is above the pituitary gland and pituitary gland is below the hypothalamus. So hypothalamus and pituitary gland is connected via a stalk. Then anterior pituitary gland has two parts, anterior pituitary and posterior pituitary. So anterior pituitary and hypothalamus is connected via blood vessels, and posterior pituitary and hypothalamus is connected via nerve fibers. Okay, so we'll discuss it. Like size is p-shaped, then weight is 500 gram, and pituitary gland is also known as master gland because it controls the other activity of the other gland. Okay, because both hypothalamus and anterior pituitary controls the activity of other glands of the body. Okay, so anterior pituitary is also known as adenohypophysis. Anterior and adenohypophysis. Okay, anterior, here the name is anterior, so its name is related to that, so adenohypophysis. And posterior pituitary, it is known as neurohypophysis. Why it is neurohypophysis? Because posterior pituitary and hypothalamus is connected via nerve fibers. So nerve is also known as neuron, nerves. The unit of nervous system is neuron. Okay, so its name is therefore neurohypophysis. Okay, so coming to the next part, anterior pituitary is made up of glandular tissue and the posterior pituitary is made up of nervous tissue. You can already see that posterior pituitary is connected to the hypothalamus via nerve fibers, so it is made up of nervous tissue. Okay, then hypothalamus connect with anterior pituitary via blood vessels and hypothalamus connect with posterior pituitary via nerve fibers. Okay, so it secretes 6 hormones. Anterior pituitary secretes 6 hormones by the order of hypothalamus. Hypothalamus gives the order to the anterior pituitary that you have to secrete some hormones. So what are those hormones? Growth hormone or somatotropin, thyroid stimulating hormone by THH, adrenocorticotropic hormone ACTH, follicle stimulating hormone FSH, lutein hormone or luteinizing hormone LH, and prolactin hormone. Okay, then posterior pituitary, it secretes mainly 2 hormones, that is ADH and oxytocin. Okay, so ADH is also known as vasopressin, antidiuretic hormone or vasopressin. So up to this, I hope you will understand. Then we'll discuss about growth hormone and or you can say somatostatin. Okay, somatotropin. Yeah, somatotropin. So growth hormone, its role is it helps in growth and development of body cells, especially in the bones and skeletal muscle. Growth hormone especially helps in development of bone and skeletal muscle. So it helps in protein synthesis. It determines the size of the body. So everyone has different body. Someone is tall, someone is short. Okay, so it is depend upon the secretion of growth hormone in the childhood. So the growth hormones amount is increased in the childhood, but it is slowly decreases. The secretion of growth hormone slowly decreases in the adult. Okay, so it determines the size of the body. It regulates metabolism in many organs. Example, liver, intestine, pancreas. It regulates metabolism of those organs. It helps in tissue growth and repair, especially during childhood. Okay, during childhood, if growth hormone is sufficient or normal, then the child's growth is normal. Okay, so its mechanism is hypothalamus secretes GHRH, that is growth hormone releasing hormone. Its hypothalamus is the boss. He secretes GHRH. Then he it it hypothalamus is the boss. He secretes GHRH. Then on the anterior pituitary, then anterior pituitary is stimulated. So then anterior pituitary secretes GH, that is growth hormone. That means hypothalamus is the boss. He secretes GHRH. Then it stimulates anterior pituitary. Anterior pituitary is working under hypothalamus, so he got the signal from the hypothalamus that hypothalamus gives me the order of secreting GH. Okay, so I will secrete GH, growth hormone. Okay, so when the growth hormone is enough in the body, then the body's gives us a signal to anterior pituitary that we have enough of growth hormone and we does not require any more growth hormone. Okay, so it sends the signal to hypothalamus that there is no more requirement of growth hormone, so you have to stop sending this hormone, stop secreting this hormone. Okay, so then hypothalamus secretes growth hormone releasing inhibitory hormone, then anterior pituitary stops releasing growth hormone. Okay, the secretion of growth hormone is greater at night time during sleep and also stimulated by exercise. Okay, so when the child sleep pattern is normal, that means child is sleeping nicely at the night time, then growth hormone secretion will be normal. Okay, and it is also stimulated by exercise, so exercise is also important for child during his childhood, and also it is important for the adult also. Okay, so coming to the next point, hypersecretion of growth hormone and hypersecretion of growth hormone. When growth hormone is releasing more than enough, then it is called hyposecretion, and when it releases very less amount of growth hormone, it is called hyposecretion. That means hypo means very low. So due to hypersecretion, due to lots of secretion of growth hormone, there may be some diseases. Okay, in childhood, in children it is called gigantism, and in adult it is called acromegaly. So in gigantism, what happened, the gigantism children is characterized by excessive growth of long bone or limb bone. They may grow up to 2.1 to 2.4 meter. That means they may be, their height may be abnormally grow. Their height is very high. Okay, so in adults, which is characterized by large extremity, excessive growth of lower jaw and enlarged tongue. Okay, so hyposecretion, there is when there is less secretion of growth hormone, what happen? Dwarfism occur. Pituitary dwarfism in childhood occur, where the individual is of short stature. The person becomes short, then but mental development is not occur here. Person is mentally fit, but his stature is short, and puberty may be delayed. Now about THS or thyroid stimulating hormone or thyrotropin. So what is thyrotropin? Thyrotropin is a hormone that is released by anterior pituitary, and it stimulates thyroid gland to secrete T3 and T4, that is triiodothyronine and thyroxine. Okay, so it also influences the growth and activity of thyroid gland. Here it is written. Okay, so release of hormone is decreases in early evening and increases in the night time. Okay, then THS, when THS is increased, then it is called hypothyroidism. When THS is decreased, it is called hyperthyroidism. That means you will understand later on when we will discuss about thyroid gland. You will understand this THS and T3 T4 hypothyroidism, hyperthyroidism, and that topic. Okay, so THS, when thyroid stimulating hormone. Okay, first we'll discuss about mechanism, then you can understand. So hypothalamus is the boss, so it secretes TRH, thyrotropin releasing hormone. It secretes, then it stimulates anterior pituitary gland, then anterior pituitary gland secretes THS, that is thyroid stimulating hormone. Then thyroid stimulating hormone stimulates thyroid gland, and thyroid gland secretes T3 and T4. So when T3 and T4 is high in blood, it is called hyperthyroidism. T3 T4 increases, it is called hyper, that means more. Okay, when T3 T4 increases, then thyroid gland will ask to anterior pituitary that we have enough of T3 and T4 and no more THS is required, or no more T3 and T4 is required. Okay, so you have to stop secreting. So you have to stop secreting THS. Okay, so then THS decreases. So when THS decreases, then you have to understand that in my body there is lot of T3 and T4. That is means hyperthyroidism. That's why THS secretion is decreased. Okay, and vice versa, when our body has less T3 and T4, okay, less T3 and T4, then our body needs more THS to stimulate thyroid gland and secrete T3 and T4. This is the mechanism. Okay, now about ACTH, that is adrenocorticotropic hormone. Here the name itself says about adrenocorticotropic. That means it stimulates adrenal gland. It does not secrete by adrenal gland, but it is secreted by anterior pituitary, and it stimulates adrenal gland. It only stimulates the adrenal gland to release adrenal hormone. Okay, so here hypothalamus secretes CRH, that is corticotropin releasing hormone. It stimulates anterior pituitary to secrete ACTH. Then ACTH stimulates adrenal gland to secrete steroid hormone or cortisol. Okay, so hypothalamus is the boss everywhere. Okay, and below his this hypothalamus, anterior pituitary works. Without the permission of hypothalamus, anterior pituitary doesn't work. Okay, and anterior pituitary then secretes its hormone, and it will act on the target organ. Then target organ will secrete his hormone. Okay, so ACTH stimulates adrenal gland to release their hormone during stress. CRH stimulate ACTH. That means when you are in stress, then CRH, that is corticotropin releasing hormone, stimulates adrenocorticotropic hormone. That means adrenocorticotropic hormones are emergency hormone. They give flight and fight response, emergency hormone. Okay, so ACTH levels ACTH level increases at about 8 a.m. at the morning time, and it decreases at the midnight, because at the morning time we are in rush, we are in hurry. Okay, we'll go for the whole day, we'll go for the work. Okay, so there is requirement of lot of energy. Okay, so ACTH level is high about 8 a.m. but at the midnight what happened, we are lazy, we are lethargic. Okay, so this hormone releases less. Okay, so coming to the point, gonadotropin, sex hormone. Hypothalamus releases gonadotropin releasing hormone. It secretes anterior pituitary to secrete gonadotropin. So there is two type of gonadotropin, FSH and LH. Follicular stimulating hormone and LH, luteinizing hormone. So FSH, it both works on male and female. Okay, in female it stimulates what? FSH, what it will do? FSH, follicle stimulate. That means it stimulates the production of follicles or production of or development of eggs in the ovary, and in male it helps in the development of sperm production. Okay, in the about LH, in female LH what it will do, it stimulates secretion of progesterone and estrogen by the follicles. In the menstrual cycle, what happened in the 15 days, in the 15 days, okay, from first day to 15 day, at 15 day LH secretion is high, because at that time the ovulation occur, the egg from the follicle releases. Okay, so the progesterone estrogen secretion is high, because ovulation releases this hormone, ovarian hormone. Okay, and at that time the female is most fertile. Okay, you can remember these things relating the menstrual cycle. Okay, in male what happen in male, LH helps in secretion of testosterone. Okay, testosterone hormone. Okay, we'll discuss it in the next page. Okay, so coming to the next page, so here it is written, it stimulates the interstitial cell of the testis to secrete male hormone testosterone. Okay, so prolactin hormone It is secreted during pregnancy and it prepares the breast for milk production. After childbirth, the suckling of the baby stimulates the prolactin production and secretion. Okay. Then the mechanism is hypothalamus secretes prolactin releasing hormone. It stimulates anterior pituitary. Anterior pituitary release prolactin. When prolactin level is more than the normal level, then it sends the signal to hypothalamus that you have to stop secreting prolactin releasing hormone. Then hypothalamus releases prolactin inhibitory hormone. Okay, inhibiting hormone it releases. Okay, so you can understand that prolactin hormone helps in the production of milk in the pregnancy. Okay, so now about the hormone that is secreted by posterior pituitary. So posterior pituitary secretes mainly two hormone, ADH and oxytocin. Now about ADH, it is antidiuretic hormone. The name itself describe that antidiuretic. That means diuresis means urination and secretion of urine or formation of urine. Okay, so diuretic means there is no formation of urine, no production of urine. Okay, no urination. Okay, so what hormone helps in less urination? Okay, so it is ADH. That means it inhibits or prevents urine formation or diuresis. It acts on kidney and increase water absorption and reduce urine volume and helps to prevent dehydration. That means it acts on kidney and increase water absorption. Kidney absorbs water. Okay, when kidney absorbs water, then automatically it will release less amount of urine. Okay, into the urinary bladder. Okay, then when water is absorbed in sufficient amount, then our body is preventing ourselves from dehydration. Okay, so during dehydration or hemorrhage or vomiting, what happened? Our body lost lots of water. Okay, our body lost lots of water during vomiting, during blood loss, lots of water. Body doesn't have sufficient amount of water. Then what happened? Then ADH, posterior pituitary, automatically releases ADH. That means ADH secretion is increases. That means he knows that our body is depriving of water. Okay, so he has to maintain the water balance in our body. So he comes in sufficient amount, and then he asks to kidney that you have to absorb the more water and you have to save the person from dehydration. Okay, then more water is reabsorbed and then urine output is reduced. Okay, but when a person is taking alcohol in enough amount, okay, then what happen? Or if a person takes large amount of fluid, what happen? Then what happen? Our kidney doesn't absorb all the water because our body doesn't need lots of water. Only a particular amount of water our body needs. Okay, therefore ADH secretion reduced, and when it is reduced, kidney cannot absorb water, and then what happened? The water is passing through urine. Okay, here I am writing that when ADH increases, water reabsorption increases. Water reabsorption increases and then urine output decreases. When ADH decreases, water reabsorption also decreases and urine output increases. Okay, that means when you have lots of hours of urination, your urination is more than enough, then what hormone acts on your body? ADH. That means urination is connected with ADH, that is inversely proportional. Okay, now about oxytocin. Oxytocin plays important role during childbirth. Okay, so it helps in contraction of uterus during the expulsion of the child, that is expulsion of the child. It gives the labor pain. It is the main hormone that is responsible for labor pain. Okay, this labor pain helps in expulsion of the fetus. Okay, then so when the oxytocin level is very low in the pregnant lady, that is going for delivery. Okay, then artificial oxytocin is injected to that lady for her labor pain. Okay, then it also helps in what? Milk ejection. Prolactin and this oxytocin helps in milk production. Okay, so thank you class.